Hi, my name is Nick. I'm a pharmacist. I've been practicing pharmacy for the past 16 years. I practiced pharmacy in 5 different countries. I'm very excited with the flu shots now. I've been giving the flu shots since we started here in Ontario, so it's about 4 years now. I've been giving shots in general for the past 10 years, and it's really exciting now that we can do it here in Ontario. I found that in the past few years, the number of people who are getting the flu shots have either doubled or maybe tripled.
Hi.
I'm interested in learning about the flu shot.
Oh, very good. You're right on time. Many people who are coming to the pharmacy are first-timers. It's very convenient now for people to swing by pharmacy and get their flu shot done. It takes about 5 minutes. We ask people to stay in the pharmacy for about 30 minutes afterward just to make sure that they're safe. But generally speaking, it's very convenient, it's very quick, and people really like it now. So the flu is a short form for influenza virus. So influenza virus is a respiratory tract infection, usually cause some issues or problems with our nose, throat, and lungs. Typically, it can happen throughout the year, but it's most prevalent during the winter season. Starts usually about April and lasts for 6 months. Influenza is an airborne virus, so it's spread through the air. So if coughs, sneezes, or talk, it could be spread, so the virus goes into the air and somebody else can catch it. The flu can be very serious. Good news that most people who will catch the flu will get better. The only thing that they will have to suffer through it. Usually each year more than 12,000 people will be admitted to the hospital because of the flu. Death rates is more than 3,000 people every year because of the flu as well, so it's a serious thing. There are now some people who are in higher risk category than others, so I'm speaking about kids like 6 months to 60 months maybe. Older people, so 65 years and above, pregnant women, people with some conditions like diabetes, blood pressure, things like that, so they are more prone to complications and they need to be more careful. Complications of flu could be something like pneumonia. Pneumonia, people can be hospitalized for up to 2 or 3 weeks, so it's something that we really need to consider. Common cold and flu have similar symptoms. One of the major things that people need to know so they can differentiate between cold and flu is fever. So we rarely pick up fever when we have common cold, but flu, it usually is sudden high fever. So I'm speaking about 39 degrees centigrade or 102 Fahrenheit. Usually picks up very quickly. People would feel some aches and pains, headaches, sore throat, coughing, loss of appetite, general feeling of tiredness and being unwell. Flu can be prevented in many ways. I would start with a simple thing, so wash your hands, use hand sanitizer. Second thing I would say, left is best. So we always tell people if you're coughing or sneezing, use your left arm. I would also say if you're sick, stay home, don't share it. And last thing, I would definitely encourage people to get immunized. So the flu shots would always remain the best way to prevent the flu. I think everybody needs to get the flu shot, but there are people who are in a high risk category. Young kids, like 6 months and above, should get the flu shots, and older people, so 65 years and above, should definitely get the flu shots. Second thing, I would say people with chronic disease, so anybody with blood pressure issues, with diabetes, congestive heart failure, they are more prone to catch the flu, then they definitely need to get the flu shots. And last thing, we need to think about people who are helping others, but they can transmit the infection. So I'm speaking about caregivers, healthcare providers, people who are around other people, so they definitely need to get the flu shot, then we prevent the infection from spreading. Getting the flu from the flu shot is just a myth. So no, we can get the flu from a flu shot. The flu shot that we use are killed virus. They are dead. They are very much well dead. So no, we can't. The flu vaccine is like any other kind of vaccine or medication. Nothing is 100% guaranteed. So I think the reason behind the myth is that people still can catch the flu even if they got the vaccine. So they think that they got the flu because they got vaccinated. However, even if we catch the flu after being vaccinated, it is usually less in severity and less in duration. So it's basically much better than not having the flu shot to start with. So we have different kinds of flu shots. I would speak about the two main kinds. So the first kind is called the live attenuated, which basically means it is live virus, but at the same time it is attenuated or weakened. So it is specially designed in a way that we get the good out of it, but not the bad. So basically it is designed in such a way that it cannot harm us. Every person would get just enough to stimulate our immune response. So basically our immune system would get introduced to the virus and it would kick in once we catch the flu, and our body or our immune system recognize that this virus is now inside our body. The second kind is the inactivated virus, and this virus is actually not live. We produce it in labs and we inactivate it using heat and several chemicals. So it's pretty much not live, it cannot grow in a human body, and therefore it cannot infect anybody. There are some side effects to the flu shots. They're usually very mild, and I would say actually most of the people would develop no side effects to the flu shots. However, if they did, they're usually very mild, and they're usually, I would say, last between 1 to 3 days maximum. Some of these side effects might be some fever or chills, irritability, tiredness, maybe some headaches or redness and swelling around the injection site. But again, they're usually very mild and they're not usually bothersome at all. Another possible side effect would be the anaphylactic shock. It's a very, very rare side effect to happen. I would say it's approximately 1 in a million. However, it is something that we usually care for, and it is usually something that we would be proactively just like making sure that everything is okay. We do a pre-shot screening, so we ask people questions, we make sure that they don't have any allergies to anything, they are not on blood thinners, they have the flu shot before. So basically, we kind of know the history and we are proactively getting ready if anything happened. After we do the pre-screening questions, we also have medication that we need if anything happens. So I'm speaking about EpiPen, a junior EpiPen, an EpiPen for adults. We have Ventolin. We have things that we would be ready to use if anything happened. Again, it's a very rare thing to happen, but usually we are very well prepared to it. Also, one more thing we usually do, we ask people to stay in the pharmacy for 30 minutes. If there is any side effects going to happen, usually they appear within the first 15 minutes. People don't have to sit down, they can wander in the store, but just we need to make sure that they are safe and they are in a close proximity of us so we can help them if anything happened. If somebody has a reaction to the flu shot, I would still expect it to be something very mild. So maybe just apply a cool, moist cloth to the injection site. If somebody felt any pains or aches, I would go for Tylenol maybe or Advil, any painkiller. Some people might feel some muscle pains or aches around the injection site. Proactively, I usually tell my patient just like go for a couple of pills of Tylenol, not to feel any pains or aches. And if they felt anything, they're usually very mild. However, if somebody is really in a pain, he feels that something funny is happening, I usually encourage them to call the pharmacy back right away or check back with their doctor because we want to make sure that everybody's safe. I would remind people as well not to use aspirin for kids. Egg allergy is one of the most commonly asked questions before people usually get their flu shot. Egg allergies is no longer a contraindication to the flu shots. Anybody with egg allergies is more than welcome to get his flu shot. Like many studies have been done through this, and it is totally fine now to get your flu shot if you're allergic to eggs. Flu vaccine are under very strict cold chain requirement. So the cold chain starts with a public health unit. So we receive the vaccines in a, like I would say, cool trucks or a coolers. So we always make sure that they are in the proper temperature. Once they arrive to the pharmacy, we get them into our fridges right away. Our fridges are especially designed to hold vaccines. We fill them with bottled water as well, and this makes sure that there is no fluctuation in the temperature. We have thermometers that record the highest temperature and the lowest temperature, so they always needs to be between 2 degrees centigrade and 8 degrees centigrade. So if it went above or below this range, it usually beeps and gives us sounds. If we had any fluctuation in temperature, we usually report it to the public health unit right away. We usually don't get the flu vaccines out of the fridge unless there is somebody waiting for it, so we want to make sure that they are always kept in the fridge at all times. So the last thing in the cold chain process that we always keep in mind is just like emergency procedures. We usually have a cooler in our pharmacy that have the same maximum and minimum thermometer. It has a cooling blanket, it has ice packs, and this is just an emergency if we have a blackout or something. So all the vaccines would be transported from the fridge to the cooler, and then we usually manage to get it to another working fridge right away just to make sure that it is in the 2 to 8 range that we always wanted it to be. When the flu season is here, the good thing that people usually know about it, so they start being proactive, they call us, they inquire if we have the vaccine as of yet or no, if they need to book up an appointment, if they can just like walk in. So it's a good thing that people are well informed now. I would like also to tell people who haven't had the flu shot before that it is welcome for anybody to walk in. So pharmacists now give the flu shots to anybody. So they don't have to have a whole profile in this pharmacy. They can just walk in. Most of the pharmacies are giving it with no appointment now. Although we usually encourage people to have an appointment, then we can just set up our date and there is no wait times and things like that. But if somebody cannot book an appointment and he just want to walk in, most of the pharmacists would do it for him. So a typical flu shot scenario where people would come in, we will hand them out a form to fill. This form is basically just like a glance at their medical history. So if they have diabetes, if they have blood pressure, if they are on any sort of medication, if they have allergies, their full name and date of birth and things like that. The pharmacist would then go through the form, just make sure everything is good to go. If we have more, I would say, inquiries, then we start asking them questions if we are in doubt about anything. And once we made this clinical decision that they are fit to have the injection, we go ahead and give them the injection. After the patient has filled up his form already, it is our job to fill out our section of this form, which basically have the drug identification number, the expiry date, and the lot number. Process to follow when you are withdrawing the vaccine from a multi-dose vial. First of all, as usual, sanitize your hands. Remove only one vial from the refrigerator. Select and read the label on the vial, checking for the expiry date and lot number. Visually inspect the vaccine. Do not use if it appears discolored or if you notice any particulate matter or if the vial is defective. Remove the rubber tip. Swab the top of the vial and allow it to dry. Select the appropriate syringe and needle. Draw up vaccine immediately prior to the administration. When preparing a pre-filled nasal sprayer, use the following steps. First of all, sanitize your hands. Remove only one pre-filled sprayer from the refrigerator. Select and read the label on the pre-filled nasal sprayer, checking for the expiry date. Ensure the lot number on the sprayer matches the lot number on the box. Visually inspect the vaccine and do not use if it appears discolored or if you notice any particulate matter or if the pre-filled sprayer is defective. Remove the rubber tip protector. Do not remove the dose divider clip at the other end of the sprayer. Sprayers are usually discarded after administering the vaccine and the lot number is recorded from the box. To recap, we spoke about receiving the vaccine, cold chain process, checking the vaccine, preparing it, and the patient consent. Now we're going to move forward to administering the vaccine. Procedures for the injectable vaccines. Sanitize your hands. Recheck the vaccine label and the record to verify you have the correct vaccine for each client. Position the client's arm for injection. Swab the site of injection. Allow the site to dry for 10 to 15 seconds. Now secure the injection site using the appropriate stabilization technique for the client's age. Insert the needle at a 90-degree angle. Administer the vaccine with a controlled pressure. Use a cotton ball and apply pressure to the injection site. Once you have administered the vaccine, activate the safety engineer device. Discard the needle and syringe and empty the vaccine vial in an appropriate sharps container. And then reinforce the 15 minutes wait period with the client. Administering the nasal spray now. Sanitize your hands. Recheck the vaccine label and the record to verify you have the correct vaccine for each client. Sit upright with head tilted slightly backwards. Place the tip of the nasal sprayer just inside the nostril with a single motion. Depress the plunger as rapidly as possible. Pinch and remove the dose divider clip from the plunger. Place the tip of the nasal sprayer into the other nostril now to administer the remaining vaccine. Discard the empty nasal sprayer into an appropriate sharps container and reinforce the 15-minute wait period with the client. Don't forget, before the patients leave, give them their vaccination card.